All right, so this is pre-optometry essential session. Like I said, my name is Helen Wilson. I'm the lead pre-optometry advisor at Wayne State. And this session talks about how to be a competitive applicant for optometry school. So as we go along, if you have any questions, feel free to write them in the chat. You could unmute yourself. Again, I want this to be as informative as possible. So feel free, like I said, to ask any questions. And there should be an attendance link in the chat, but we also have this attendance. If you want to take a picture with the QR code, if you haven't already signed in, then feel free to do this because I want to make sure I send out all the slides to everybody that's here. So make sure, you sign in and let me know you're here. Okay. All right, so the first question is, why are you interested in becoming an optometrist? Are you here today because you decided for sure you want this plan, or are you just checking out different healthcare options? And that's fine too to be here. So just take a moment and write in the chat or unmute yourself if you'd rather talk. Why are you interested in becoming an optometrist? Like, why did you attend this session today? So just take a minute, write in the chat, what prompted you to attend today? Do you want information about the path? Are you definitely, enjoy helping people with their eyes? Or, what's kind of prompting you for thinking about optometry? Any thoughts on why you're interested? You can write anything in the chat you want. You can write or unmute yourself if you're not sure of your path and you just want to get some information, general info, okay. Learn about the path, okay. Okay, Caleb, you're exploring different paths, okay. Prove their vision, okay, Suad, so you've decided that's what you want, okay. Okay, so it sounds like some of you are here because you want to learn about the path. Some are here because you decided you recently want to go into this, like Gabby and Suad. Okay, all right, that's helpful. Okay, thank you for sharing. So what we're going to do today is we're going to be talking about some of the services that we have in pre-optometry advising. We're going to be talking about my role. We're also going to talk about the role of an optometrist because that's why you're here today, to learn about that role. We're going to talk about the 4 components of optometry school application and the cycle of applying, as well as interviews and ways that you can improve your application. And then certainly any questions you have, I want to answer at the end, but if you have questions during the session, like I said earlier, feel free to unmute yourself or write in the chat. Okay, so the first thing is, what is a pre-optometry advisor? We are what's called supplemental advisors. You don't pick us at orientation because you're going to your major advisor, whatever you chose for your major. It could be biology, it could be chemistry, it could be psychology. So we're additional advisor to help you get to where you want to go to apply to optometry school. So that's the word supplemental advisor. Now, to schedule an appointment, you would go to stars.wayne.edu and you would look for pre-optometry. If you're wondering who else does optometry besides me, you could look at that top left link where it says staff, and you should see Laura Hetzler. She's the other advisor for pre-optometry. So basically, we're here to help you create a plan of work, figure out classes that you want to take, but we're not your main advisor. But you still want to meet with us because you need us to make sure you're taking the right classes, you're doing the right things to apply to optometry school. Does that make sense with everybody, what supplemental advising means? Any questions about that? Let me see if there's any questions in the chat. Okay. Oh, okay. I can see more detailed answers. Thank you for all of your answers. Thank you. Thank you. Okay. All right. So what we want to do now is we want to think about, when you think about optometry, what are the services that we offer at Wayne State? We don't have an optometry school, of course, but we do have sessions like this one called Essentials, where we go over the general information. We also have workshops. Tomorrow, we're having a workshop where we have all these optometrists that are doing residencies are going to come at 6 o'clock, and it's going to be on Zoom, and they're going to talk about their information related to residency. So if you're interested in coming to that, just put that in the chat. Would like to come learn more. Certainly, you could have appointments with me individually. Oftentimes, I'll create a plan of work with students in degree work so you can know what's coming every semester. And then yesterday we had a school visit. We had U of D Mercy School of Optometry. So sometimes we'll even have workshops where they come in person. And that was a great session. He went over, all the information about applying to U of D Mercy for optometry. And that's a brand new program, just started this year. So he was explaining about accreditation and all that. So a lot of times we'll have some schools come in person, like I said, and some schools, like tomorrow, is going to be talking about residency. So sometimes we have special focuses of the workshops. In the last few years, we've had a panel where we've had 5 or 6 different schools of optometry come, and we call it an application panel. So we ask them questions about that. And like I said, we've had schools come in person like on Monday. So. And then another thing you want to know about when you're thinking about optometry is, what is a doctor of optometry? On the first line, it says they're the primary eye healthcare providers and the front line of eye and vision care. So these are the doctors that are going to examine, diagnose, treat, and manage diseases and disorders of the eye. They can prescribe medication. They can help with low vision rehabilitation, vision therapy, glasses, contact lenses. They can also counsel patients regarding surgical and non-surgical options. And then they can also work in different modes of practice. When you hear modes of practice, it means a different type of practice. So it can be private practice, it could be corporate, it could be a hospital, or it could be an OD/MD practice, VA, military, community health, academia, industry, research. So when you apply to a school, oftentimes they'll say, make sure you have 2 or 3 modes of practice. So you can network, you can meet an optometrist, and then you could say, do you know someone in a corporate setting or a hospital setting? And then you can find these other modes of practice. There's only one school I've found that says 5 modes of practice, and that's the other school in Michigan at Ferris State. They seem to want 5 modes. But as far as the overall role is that you are examining, diagnosing, and treating and managing diseases and disorders of the eye. Is that pretty much what everybody thought? Is that new to anybody? If that kind of confirms what you thought, just kind of write in the chat, yes, that makes sense. Or if that's new, just write new to me. Some are new. Okay, some make sense. Okay, all right. And like I said, you're going to get these slides so you can kind of, review everything that's here. Now, the doctors of optometry, it says here at the top, they're independent primary healthcare providers. Like I said before, examine, diagnose, treat, and manage. So this is the definition from the American Optometric Association. Now, another way to look at it is you're earning a Doctor of Optometry degree. That's the title of the degree that you're going to get. It's an OD. That's the abbreviation for Doctor of Optometry. So you're going to work with people who need their eyes examined. Maybe they have some eye or health problems. You could be prescribing eyeglasses or contact lenses, but you're not an ophthalmologist. If you've heard that term ophthalmologist, that's someone who goes to medical school and you have more to do with the diseases of the eye. So when you see this definition in yellow and the one in white, what do you connect with in the optometrist role? Do you connect with the idea of being a specialist? Do you connect with talking to patients? Maybe you're looking forward to that talking role. Do you connect with the diagnosing, the treating? Think about what you connect with. If you connect with diagnosing, write diagnosing. If you connect with managing or treating, just write something in the chat of what you connect with. Or maybe it's the patient. Maybe talking to the patients is what you connect with. So look at those definitions, the white and the yellow, and think, what do you connect with? Maybe you're looking forward to the diagnosing part. Maybe you want the examining part. Diagnosing, patient care, treating. Okay, all right. So it looks like you're connecting with several different areas. And the reason I'm asking these questions is because this is part of developing your motivation for this field. Because you want to really think about what is drawing me. Examining, good. Treating, that's great. That's great. So you want to really think about what is drawing you to this field. Now, there's different ways to learn about the role. You can review our website, and I have it down there at the bottom left if you want to take a picture. You can also meet with Career Services Counselor. Their website is on the right there. And then, of course, the ideal way is to talk to and shadow an optometrist. And if you don't know anybody now, no worries. We can always find somebody and figure that out as time goes on. But remember, when you're exploring a field, if you're here for the general info, maybe you're not ready to do it yet because you haven't wanted to take that step. But if you did want to take the step, these are some of the ways that you can do it. On the website, we're going to have information about not just the classes, but the whole field of optometry. So definitely a lot of the same things we're talking about here today. Career Services is going to be able to tell you the salary. How much are you going to earn as an optometrist? They're going to tell you about the occupational outlook. One of the things you want to know when you're checking out a profession is there going to be growth in this field? Are there going to be jobs when I graduate? You want to definitely know all that stuff, and Career Services can help you figure that out. They also have a assessment, it's called Focus 2, that helps you understand your own self-awareness, your interests, your values, your skills, your strengths, and you can make sure that you're aligned with this career. I have a lot of students that take that assessment. If that's something that interests you, just remember Focus 2, and then you could, set that up with Career Services. And if you want the link to exactly where to take the test, let me know and I can send that to you. But that's an option. You always want to make sure you're aligned, with the right career that you want to go into. Now, when you're applying to optometry school, they have something called the Common Application System. Some of you may have heard that when you applied to college, you had the Common App. So this is similar, but this is called the Centralized Application System. It's a big acronym, Optum-CAS. And when you hear the word CAS, that stands for the Centralized Application System. Which link were you asking for, Tezria? Oh, the Focus 2? Oh, yes, I can send it to you. Yep, yep. Don't let me forget. I will. So, whoops, let me come back out here. Okay. So when we're looking at optometry schools, we want to break the information down in terms of what is on the Optum CAS. There's lots of CAS systems. Pharmacy has it, physical therapy, occupational therapy, all of that. But on the CAS system, when they're looking for applicants for all the optometry schools, they are looking for the grade point and the coursework. You want to have a target grade point. When I say grade point, I mean overall grade point of 3.5. Now, it doesn't mean that you won't get in if you have less than that, but you want to target 3.5. And schools look at science grade point too. And you want to know like what each school wants for the science grade point. So on our website, which is listed here, right here in front, they have a section which is academics. And if we have time, I can take you in and show you how you could look that up. The curriculum, as far as the classes that you take for your coursework, is based on the optometry admission test. The abbreviation for that is OAT, O-A-T, and that's in the bottom right there. So it's not just the grades, but you have to have certain classes to apply to optometry school. So you have to have a year of English, both English 1020 and 3010. So if you're taking English 1020 now, then you could take 3010 in the winter, but it doesn't have to be right away. If you're not taking English 1020, take that first, and then you would take 3010 after that. You have to have one semester of calculus, and if you have advanced placement or IB credits, that's allowed. You have to have an academic year of inorganic chemistry with a lab. So that's Chem 1110, 1130, and then you would go to 1140, 1150. And if you're wondering, well, how do I organize all this? That's where I come in, or Laura, that we can sit with you and we can create a plan of work and organize what class to take when. With the math, if you didn't place into that level, then we can guide you what math to start with, and then the next one and the next one. Back to organic chemistry at the bottom, you have to take Chem Temp 1240, 1250, and some schools don't want a second semester of organic chemistry, so you have to check with the schools that you're interested in. And like I said earlier, we have a lot of different schools that come to campus, but if part of what we need to think about is, do you want to stay close to home? Are you wanting more of an urban school or rural? You know, all those things, you know, we'll talk about as time goes on. Any questions about the chemistry, English, and math before I go to the next slide? No questions? Okay, I'll go to the next slide. So with biochemistry, you have to have one semester of biochemistry. If you're a bio major, you tend to take the Bio 3100. If you're a biochem major, you tend to take like the Chem 6620. Chemistry major, you could probably take 5600. But you would take biochemistry later. You wouldn't take that right away. You'd probably start with 1500, 1501, or 1510, 1511. And then you do need a course in microbiology. The difference between 1510 and 1500 is 1510 is cells and molecules. 1500 is plants and animals. Any questions about the bio? If you're in 1050 now, you would go to 1510 next, 1511, and then 1500. And again, I can help you put a plan of work together. You have to have one academic year of non-calculus based physics. 2130 in the lab, 2131, and then 2140 in the lab, 2141. Whoops, excuse me, let me go back. You could take calculus-based physics, but most students take the algebra base, the non-calc based. You need 1 semester of statistics, and the classes are listed there, and they'll take AP or IB credits. Psychology, you just need 1 semester. Classes are listed there. And some courses may be required depending on the particular optometry program. Sometimes they want additional classes. So with freshman and sophomore, that's when you would take bio. Freshman and sophomore would also be Chem 1 and 2. Junior year would be more organic 1 and 2. Statistics, freshman and sophomore. English, freshman year for 1020 and sophomore year for 3000. I think we had a question here. Let me see. Let me see the question. Could we take math 2210 instead of stats 1020? If that class is listed on their website, we probably should double check with the school before we say yes to that, just to be sure. Okay, and if you're not sure what school, then let's talk about, some of the likely schools that you could go to, just to be sure, because I'd hate for you to take a class and they don't count it. Okay. All right, so let's go back to the classes. So any questions on when to take what classes? Is this making sense about the bio, the lower bio, the first years, and the lower chemistry, and then higher after that? Okay, looks like everybody's got that. So biochemistry would be more the junior year. Psychology, you can take where the class fits, and your choice if you take it with a lab or not. Psych 1010 has a lab, 1020 does not. Calculus could be freshman or sophomore year. Physics is more junior year. And again, let's do a plan of work so we can, have it all typed out on DegreeWorks, or we could do a separate plan on a piece of paper and follow that. So the second thing you need besides the grade point and the coursework is extracurricular activities. You have to have optometry related experiences in shadow. When you shadow, you're showing you're committed to being an optometrist and you understand the role. Schools have a certain number of shadowing hours. The school that was just here, I think, said they want at least 10. But you want to also think about other ways to get it. Some people get jobs at Optimize or Eyeglass World or SVS Vision, but you could also just set up shadowing with different optometrists. Keep in mind that every school has an expectation of how many different settings or modes of practice that you need. So if you don't know that, let's look on the website and find out. Let's call the school and find out. If you're not sure what school you're going to, I would say a rule of thumb is at least 2 modes of practice. Like I said, there's only one school that I found that wants 5. So I would start with at least 2. And then if you are interested in a school that wants more, then we can always network and find other modes of practice. Okay. Any questions about extracurricular activities when they say optometry related experience? Does anybody know an optometrist that you're thinking about shadowing or contacting? Anybody? Okay, so if you don't know anybody, oh, wait, somebody said they knew someone? No, okay. So if you don't know of anybody, no worries. We can always, put our heads together and find people. I work closely with the Pre-Optometry Society. If you're interested in that organization, I can connect you later in the slides with the president. and we can make sure that, you come to some of the events, because we have done some shadowing in the past where optometrists would come to campus or Zoom, or students would go to their offices. So we can get you connected. So another part of extracurricular is to, like I said earlier, think about the mode of practice. So if you're going to be shadowing at a private practice, that's going to be one mode, but then you want to network to find other modes of practice too, like we talked about earlier. Another part of extracurricular is any kind of medical, clinical experience that you can find. So if you're already volunteering in a hospital or a clinic, you're certainly going to show that you're committed to healthcare, you're developing empathy and compassion. And then another way is to join a student org, and you can help out with, whoops, sorry about that again. Help out in giving back to the community, developing communication skills, leadership. So definitely think about the Pre-Optometry Society, but it doesn't have to be just that one. There's lots of student orgs on campus, and any type of way that you give back could be listed on your application. And you could develop some leadership skills too. That always looks good. So with research, schools value that, but they do not require it. And research does not have to be in a lab. You have to be able to discuss how your contribution fits within the overall project, and you need to know the transferable skills. And if you do have an opportunity to present at a conference or publish an article, you definitely want to take the opportunity and promote it on your application. But if you had to choose, I would rather you do some volunteering in the community or do some optometry related experience if you had to prioritize. But if you're certainly interested in research, then, I can help you to grow in that direction too. So the third area, so remember the first one was grade point in coursework, GPA and coursework. The second one was extracurricular. The third thing that goes on your Opt-in-CAS application is the score for your optometry admission test. Now you do not take the OAT, that's the abbreviation, the OAT, until you have finished all your prereqs. So you want to make sure all your bios are done, your chemistry, your psychology, your physics, everything is done, because that's the material that is going to help you prepare for the OAT. So it's a battery of 4 tests: natural science, which is bio, general chem, organic chem. You can see why they want you to finish all the classes. It's too much to try to learn it all and take the OAT. Physics, reading comprehension, and quantitative reasoning. So you want to take it when you're ready. You don't, like I said, you don't want to take it too soon, and then you're trying to learn all the material and study at the same time. So normally students take it the summer of their junior year. And like it says here, 2 months of intense study. And you take it when you're ready. If you have a score of 320 or better, then that is typically what you need for an interview. Not to say you're not going to get an interview if you have less than that, but that is, you'll have better consideration with that score. Any questions so far on anything? Okay. So when you register for the OAT, you have to register online at a Prometric testing center, and we do have some in this area. And you would ask the schools that you're applying to take the OAT and still qualify the year of your entering class. So normally it takes a year for your whole application. So if you were trying to apply for admission for 27, then you would be taking it in 26. And you would take it typically in the summer, and then your scores would come out right away, and then you would have it so that you could put it on your Optocast. And then all the sections are reviewed with some closer than others. So let's say when you take the test, you're not happy with your score. Let me go back there. Let's say you're not happy with your score, then you could take the test over, but you have to wait a certain amount of time. And when you talk to schools, they want to see some growth. So let's say the first time you were less than 300, but then you came up and you improved your score, then they're going to make note of that, and that's going to be considered. But again, you want to ask each school, do they have a cutoff of what they want for these scores? So, you want to be in touch with the school and know what the deadlines are. Now, the fourth thing that you need for your application, besides the GPA, coursework, extracurricular activities, and the O, is letters of recommendation. You want people who know you well. You have to get a letter from a professor with a science course, and we heard this yesterday with the school that was here from UDM School of Optometry. And you also need to get a letter from an optometrist. So remember how we talked about you're going to be shadowing optometrists. Well, that would be a perfect person to write the letter. And the school yesterday was saying what it says here at the bottom is that you have to have at least 2 letters, but Opt and Cast could hold 4 letters. So if you're going to get additional letters, let's talk about who you're going to get. Because like yesterday, the school said you can have a 3rd letter of your choice. So let's say you had all this amazing community service work that you wanted to highlight. Well, maybe you had a professor that you had worked with that community service, or maybe you had an advisor that you had worked with closely. So you could have more than 2 letters, but you want to make sure that you really cultivate these people and that you know them well. You don't want to, what I call a check the box letter, that they were, you were in their class and that's all they could say. You want to have somebody that maybe you've gone to office hours, you really build a rapport with, they know details about your life. And they emphasized yesterday with you need to have it on letterhead. There needs to be a signature and a date on the letter. So that's part of your role when you communicate with professors, to, let them know that you need the letter on letterhead, signature, and a date. Okay. And remember, you may not know anybody right now, but as you go through your time here at Wayne State, you'll get to know professors. You'll begin to figure out, who's a good person to ask and who's not. And you could always say, I always tell students, say, do you feel comfortable writing me a letter? Do you feel like you know me well enough? And if they say no, well, respect that. Maybe there's someone else who could write a stronger letter. But these letters do make a difference, and they really can help out with your application. Has anybody ever had to ask for a letter of recommendation? Anybody done that before? Suad, you did? Okay. You did? Okay. Did that, oh, for the Common App? Okay, so you guys have done that before. Did that go okay when you did it before? Was that all right experience? Did it work out all right? It was good? Okay, good, good. But you can see that, it does make a difference to, have a strong letter. So when you do the application, now this is not going to be for a few years from now. Let's say you're a freshman and you're just getting started. You're not going to be applying for a couple years. But on the application, you're going to have a list of all your classes and grades. I always tell students to get a copy of your transcript because you have to upload the exact wording of what the title was of the class. So you can always get a student copy of your transcript. And any schools you went to, not just Wayne State, if you went to community college, went to another four-year university, make sure you have that transcript. Any activities that you had, so maybe you were in a club or you had a job, and jobs you can list too, it's not just activities. You have to have something called a personal statement. Now, I've taught workshops, we've had Laura teach workshops before, but it's basically a one-page essay of why optometry. This is where you write a narrative of why you really want optometry. Because remember, they don't get to see you before they read your application. All they know is your application. So if you can kind of frame your journey to optometry to understand more about you and who you are as a person, this is where you can really shine on your application, because you really got to highlight things about yourself. And you could tell your story. You don't want to rehash everything on the application. This is more where you can kind of come to life. And if you need more help on that, we can always meet and, talk more details about that. Your OAT score would go on your application. Your letters, remember, you have to have 2 letters of rec. You can have as many as 4. There's a fee. You want to send the application fee to OptumCast. And then the transcript, you have to have your official transcript from all the schools you attended sent to OptumCast. And I can explain in more detail how to do that. It takes 1 year to apply, like I said earlier, and you check with each school for the deadlines. The application normally opens up like the end of June, early July. And if you put all the schools you're applying to, students are applying to anywhere from 3 or 4 to 5 or 6 or 7 schools, but you can, get the deadlines for each school. And then some schools have supplemental applications. Supplemental is an additional application that you have to fill out. I think we had a question in the chat. Let me see. You would send in your application during junior year if you're tracking with the prereqs. Now, let's say we do the plan of work and you're not going to finish all the prereqs until senior year, then you would have a gap year before you could apply, because you typically takes you 1 year to do the application. Because once you fill it out, then the next step would be the interview, and then you would begin to get offers. When do the application usually close? It usually closes in the following year. So usually it's in the springtime. Okay, so it typically opens in July or the end of June, depending on the date of that year, and then closes the following spring. Can I apply later on and take a gap year to prepare? Yes, you could finish your academics, all your prereqs, and then you could study for a couple months, because usually they say 2 months intense study, and then you could apply later on. So what would happen if all of my prereqs are done besides one class like calc? You could still take that class after you apply and just let the school know that you have one class that's still coming. Okay, so you could let them know. Now, remember, when you're applying and you take a class over, that is going to go into your OptumCast grade point. So we have to be careful with how we do things. You want to make sure you have the highest grades. So you want to, check with me and see how we do things. A lot of schools are kind of negative about taking all these classes at the community college, especially when you take classes at a 4-year school. But, we have to kind of see what your situation is. If you have financial issues, you can't afford it here, well, then we'll take it elsewhere. But we just always want to make sure it looks good from the optometry school angle, not just, what makes sense for you. We have to kind of look at it from all angles. Okay. But you want to have good grades, you want to be a well-rounded applicant, you want to have the optometry experience, you want to have the extracurriculars. A job is fine, being on a team is fine, but you just have to kind of show that you can multitask, because it's a very multitasking environment being an optometrist, and you want to show that you're have good time management skills, that you've been able to excel on the undergraduate level, because they're trying to make a decision. Are you somebody that we want to invest in? And so you want to show them that you are, and that you can handle it. Now, if you want to improve your application, you want to have more knowledge of optometry and yourself. So the more you shadow, the more you have a job, the more you learn about yourself. I'll find that Focus 2 link in just a minute so you can take that assessment. And then strong communication skills. Optometry is all about communicating. The more you work on communication skills, join a club, get a board position, the more you can develop those strong communication skills, the better off you're going to be with your application. And then, of course, strong letters of recommendation. Develop those relationships with those professors, with optometrists, so you can get a strong letter. You don't want a letter that just says someone was, that you were in their class. You want them to really know you and care about your future. Now, the Pre-Optometry Society, has anybody already connected with our president or gone to any of their meetings? Anybody already know about this group? Just write in the chat if you've gone to anything. Oh, Caleb, you have? Okay, good. Gabby, good, good. Okay, great. So if you haven't gone to it, please email the president, hk7176@wayne.edu. Tell her you're interested in the club. You can come to meetings. There's no obligation. If you decide that you're not really going to pursue optometry, you don't have to continue. But if this is something you're thinking about now, definitely want to come to the group, because, the students network with each other, they support each other. There's a group chat for sharing resources and support. They have Instagram. They co-sponsor meetings, like last night with U of D Mercy School of Optometry coming. Tomorrow night, they're having a panel, like I mentioned, with all these optometrists. So they do quite a bit. Plus, they have social things too. It's not just all optometry. They go out and they volunteer in the community. You could have a leadership position. You don't have to be the president. You could, have a lesser role, but that would still look good for your application. So definitely consider coming. And even if you don't take a leadership role, just knowing about the networking and all the resources would definitely benefit you for this path to optometry school. Now, this is the event we have tomorrow. So if anybody wants the Zoom, I can send it to them. And you're welcome to come. I think it's going to last about an hour. And then next week on Wednesday, we have our patient care panel, where we have all these hospitals coming. So again, if you're interested in signing up for that, just put it in the chat and I'll get it out to you. And we're going to have students who are doing some healthcare type experience talk too. I think they're from the College of Nursing. But again, this is going to be in person next Wednesday over in the Hillberry E&F. It's on this side of the student center, not the Starbucks side. And then if you want to check out other workshops we have all kinds of workshops. That's the link at the top in the black that you can take a picture or jot down. And again, I'll send out these slides so you'll get all that. Any questions about the workshops coming up that anybody has? Okay. And then this is my contact information. So let's say you want to schedule an appointment with me, you could put that bottom link where it has stars.wayne and then my access ID all on one line, and then it would take you right into my schedule. And then you could see like what days I'm open and what days I'm not. And then we're in the undergrad library right next to the hub, if you know where the hub is, to the left of the elevators on the first floor. And you just check in at the hub and then they'll tell you, where to sit to wait for me to come. You could also have a remote appointment. You don't have to come in person. So either way. And then let me put the link in the chat. We have two links. We have one if you uh didn't get signed in. Let me put that in here again. I think there was someone who came after we put this attendance link. Okay. So if you're just coming in or came in a little bit later and didn't get to sign in, that's the sign in link. And then let me find the evaluation link. So this is the evaluation link, just to give us your comments of what was helpful or not helpful and any suggestions for the workshop. So that's in the chat. And then let's see, let me find the Focus 2 link. Some of you I know wanted that. So if you click on this link, the second one says Focus 2, and then the first one is the career advising. And then let's see, who else? Thora, you wanted the Zoom link. Was the Zoom link for tomorrow night, Thora? Was that for tomorrow? Okay, let me find that. Let me get that link. Anybody else want the link for tomorrow night? Oops, that's not the right link. The right link for you. Okay, that's the link. And then the Focus 2, okay. So if you want the group chat link, just email the president. And then Thorfa, you had a question about U of D Mercy's prerequisite courses? What was your question about that? Let me stop the recording here.